Now on to a completely different area, right at the beginning of cancer. Alison Walker.
Given the recent controversy over breast cancer screening, what does the panel believe needs to be done in order to improve the early diagnosis of all cancers and to improve cancer outcomes?
Jane.
Well, I think the first thing is really thinking about which of the cancers that are need to be diagnosed early and are currently killing people. So if we really think, which perhaps haven't been mentioned in the screening controversy, so if we take lung cancer, for example, that really the really important thing is understanding the symptoms of early diagnosis and making sure that you get the right test to have the diagnosis, to have it diagnosed early. So if we take, say, colorectal cancer and lung cancer, in both of those cases, if it can be picked up early, then the outcomes will be much better. And some of the most interesting campaigns, for example, sort of the Leeds cough campaign, if you cough for more than 3 weeks, go and get a test, resulted in earlier diagnosis and more people being cured. Yeah. So I think we need to think about some of the simple things, understanding the symptoms, getting early diagnosis, and as well as some of the sort of screening controversies, if we're really going to improve outcomes.
It's very interesting. I mean, I suddenly thought, I was thinking as a child, you're going through school, you've got grandparents, you've got uncles, you've got aunts, and let's say, for example, we're aware of them coughing or whatever. Why isn't this sort of thing taught in school?
Well, I think it's at every level. It's at every level the thing. If you've got some very simple messages, if you've got cough more than 3 weeks, you need a test.
You're told about blood in the stools or all that sort of thing.
We're also, again, we've got some training tools for GPs which look at symptoms, that if you've got any of these symptoms, you need to be referred early. So that at every level, raising awareness, if you go to your GP, if you go and see another specialist.
Unless you are fully aware of the symptoms, nobody goes to the doctor or anybody. Unless you are yourself learned somewhere or you saw somebody suffering. Otherwise, you don't take the immediate action to yourself. And that's why there's a long delays because the awareness is not there. I agree that whether it is in the high school level, there should be some kind of raising awareness, or the organizations to take it more proactive role to take.
But we should celebrate the fact that there are the most extraordinary screenings going on a massive scale. I turned 65 the other day, and the next week I received a thing about a cancer I'd never heard of, something to do with abdominal, and on December the 10th I'll go along because everybody of 65 is being screened for whatever it's called, ACC something or other, something abdominal, something to do with the lining of the stomach or something.
And I was 65 a few weeks ago. I never received that yet.
Well, I live in a very, very good health area, and I've for a long time taken advantage of the bowel test, which just comes around automated. There must be more of this.
So can I just add one point here, which is maybe I'm taking away from the real issue. There are communities living here who are not familiar with the system yet.
Yes.
And they are the
very important
worst part in this, that they're not aware of the systems, they don't know the symptoms, they are still not clear whether they should go to the doctors or not. So I think that those communities living in isolation is the worst hit on this issue. How to reach them is also an issue we need to look at.
I was impressed that my letter was reproduced in Urdu, Hindi, various other languages.
I would like to see the copy of that.
Yeah, no, it's good. It's really, really impressive. If I'd brought my briefcase, I could have shown you. But, there it is. Yeah. Yes, sorry.
I do think that the national screening programs that we have, the breast screening, the bowel cancer screening, so on, they do, they do work hard to engage hard-to-reach communities, and they will be working with through Public Health England, through health and wellbeing boards in local authorities to really improve uptake of screening programmes. I think that the controversy about the breast cancer screening programme is a very interesting one, because that was really triggered by a lot of very a long period of some very negative PR around the screening programme, where a number of experts, people with scientists or researchers who are saying this programme is not, the benefits are not demonstrated through the research. And this was a very, very long kind of slow burn kind of debate that was going on.
Well, there was a lot of problems with prostate cancer, wasn't there? There still always will be. Because
but what the government did, what Mike Richards did with Cancer Research UK, was to initiate a review of the breast screening programme and also bowel cancer screening, wasn't it? And what they were trying to do there was to say, right, we're going to get independent people to look at all the evidence, because any screening programme has to be sure that these are expensive programmes, that they are delivering the benefit on a population basis, and that the evidence is there to support, literally millions of women, in this case breast screening, going along and being exposed, once every 3 years to radiation, to a mammogram. Now, I've done it. It doesn't hurt that much. It's not difficult, and if it's properly organised, you can fit it in with your life. But the review has shown that the breast screening programme really does save lives, and it really is worth continuing with it. And what happened was there was so little media coverage of the positive outcome of the review, and again they continued to focus on a very kind of negative debate around. So I think there's a real problem now with confidence in the breast screening programme, and we have to, having looked at the evidence again, we have to go out and explain to women that there are real health benefits of attending screening, and whether they're from Asian communities or whether they're from hard to reach groups, that it's really worth doing that. That screening's not the only part, it's not the only thing to do about promoting early diagnosis. So you get the rarer cancers where it's not clear what the symptoms are. It's actually getting some clear messages to GPs about what the early symptoms are to pick up on and refer to specialists and to rule out cancer rather than waiting to see if it is cancer over years. So it's a lot to be done.
Thank you. As someone who has incurable advanced prostate cancer, we need to do a lot more work on this. GPs are not gods and can't be experts on everything, but it's one of those, you can't see it, you can't feel it, and as with people in my case, it was advanced before it was found. I probably had it for 5 years or so. I was 58, and the first GP said, he put it down to my age, and he said, you must expect this sort of thing, and I went back when the pain really set in and saw another GP. I understand there is a government bill, whatever, the prostate cancer risk management programme, which requires GPs to talk to men over 50 about it, but they still don't. So I'd like more action on GPs to actually talk to men about prostates and what to look for and what it's about.
Thank you. Very good.